If you're someone who's taking metformin, then you know that metformin can help you manage your blood glucose levels. But did you know that dietary choices can also play a significant role in its effectiveness? So today we're going to talk about top foods to avoid while you take metformin. Hi, I'm Dr. Ritakshi, a medical doctor and a clinical nutritionist. Welcome back to my channel. So metformin is a medication which is commonly given to patients with type 2 diabetes and also a condition called PCOS. So it helps us lower our blood glucose levels and also increases our insulin levels. So metformin can lower our blood glucose levels by reducing the amount of glucose absorbed from our food, and also it tells our liver how much glucose to produce. Certain foods can interact with metformin, leading to a decrease in its effectiveness, and it can also sometimes cause adverse side effects. Some of the most common side effects for people taking metformin include feeling nausea, vomiting, diarrhea, or having a loss of appetite. So we must eat a balanced diet with lots of nutrients, and we must avoid the following foods while we take metformin. First on our list is alcohol. So while you might think that drinking a glass of wine or having a casual beer might be okay for you, but if you're someone who's taking metformin, the interaction between metformin and alcohol can cause adverse side effects. So believe it or not, alcohol actually lowers your blood sugar levels. So this happens because when you drink alcohol, your liver stops producing glucose, and instead it focuses on metabolizing the alcohol. So if you remember, metformin does exactly the same. It stops releasing glucose from your liver. So when this happens, both the factors will reduce your blood glucose level too much. Your sugar will go really down, and this will cause hypoglycemia. And this can also lead to a rare condition which is known as lactic acidosis. So when you're drinking alcohol, your liver gets too busy in the process to break down this alcohol that it forgets to regulate your blood sugar levels, and metformin on top of that also lowers your blood sugar levels as well, and this is not what you want. So make sure to avoid alcohol at all costs. Second is high fiber foods. Now fiber is supposed to be good for you, right? Well, yes, fiber is great. While eating high fiber foods will be beneficial in managing your diabetes, because they will slow down your digestion and they're also going to slow down the release of glucose into your bloodstream, but taking too much of fiber is not beneficial. Consuming too much fiber while taking metformin can actually interfere with the absorption of this medication. So you should not take your fiber foods and metformin together. Wait for 1 hour before or 1 hour after your meals. Now, we don't suggest that you avoid fiber at all, because fiber is very beneficial when it comes to managing your blood sugar levels. So you should take at least 30 grams of fiber per day. Third are simple and refined carbohydrates. Now these are including our white bread, white pasta, white rice, pastries, sweet snacks. Well, these are all ripped of their nutrients and the fiber content. These carbohydrates are quickly absorbed by our body, and they release sugar into our bloodstreams very fast, and this results in an increase in our blood glucose levels. So metformin is already trying to reduce or manage these spikes, and introducing more sugar to our body is just going against what the medication is trying to do. So we should not overwhelm metformin by trying to introduce more sugar and giving it a hard time. So we must opt for complex carbohydrates that are whole grains, whole breads, vegetables, fruits. These are going to have a lot of fiber, and they're going to keep you fuller for a longer period of time. Next on our list is sugar. So we are trying to keep our sugar levels on the low. So eating glucose or sugary foods is just going to go against the effect of metformin. So why must we do that? Why should we eat sugar, which is going to raise our blood glucose levels, it's going to worsen our insulin resistance, and it's going to make our metformin work really hard? So we must avoid foods like candies, sweets, desserts, pastries, sodas, juices, even your healthy smoothies. They can contain a lot of high sugar content. Here you should also avoid sweeteners, because while they do sound like a very good option when you're trying to cut down on sugar, these can also raise your blood sugar levels and they can interfere with metformin. Instead, for your sweet tooth, you can opt for a piece of fruit combined with protein, which is going to be a better option for you, and it's not going to raise your blood sugar levels. Next on our list are high sodium foods. Now, you know, metformin helps you reduce the release of glucose from your liver. Some foods, on the other hand, actually help release glucose. They give you a prompt to release glucose, and high sodium foods are one of them. Foods with a lot of sodium will actually increase the release of glucose, which is going to affect the metformin's efforts in trying to lower the glucose levels. So we must not take a lot of sodium or salty food in our diet. Next on our list are saturated and trans fats. Now these are going to have the same impact like sodium. They're going to increase your insulin resistance and they're going to make it less effective for metformin to work. So trans fats are usually found in a lot of processed foods and packaged foods, and these are going to be high in LDL, your bad cholesterol, and they're going to lower your HDL, the good cholesterol. So these are not good when you're taking metformin, because they can usually affect how metformin works against lowering your blood sugar levels. Also, trans fats are highly inflammatory, so they might increase inflammation in your body, which will further lower the effect of metformin. So saturated fat is found in your meats, red meats, processed meats, and also in your dairy products like cheese and milk. Well, we should try to take them in limit. We can choose healthier fats, and these are easily found in your nuts, seeds, in your legumes, beans. These are better options, and you can choose meats like chicken, fish, turkey, eggs for good proteins. Next on our list is grapefruit. Now, grapefruit is a healthy fruit, right? Well, yes, but grapefruit also has a compound which interferes with a certain enzyme in our body. This is the enzyme that helps metabolize and break down metformin. So, when we eat grapefruit or drink grapefruit juice, these enzymes are highly reduced, which means that the metformin is not absorbed, it's not broken down. And that means that metformin stays longer in our body. It keeps lingering around, and this can cause severe side effects. So it's best to avoid grapefruit when you're taking metformin. You can substitute this with other citrus fruits like oranges and lemons. Last on our list is caffeine. Now, most of us love to drink a cup of coffee or a cup of tea, and it's our go-to drink. But coffee or tea is a stimulant. Now, caffeine as a stimulant can actually interfere with our metformin. I hope you found this video helpful, and if you like this video, then please give it a thumbs up and share this video with others, and make sure to subscribe to my channel for more content on health and nutrition. Thank you for watching today. I hope to see you in my next video. Till then, eat healthy, stay healthy. Bye.